Today we're going to review Lorry Hill's experience undergoing a blepharoplasty, or what's called cosmetic eyelid surgery. As a oculoplastic surgeon for the past 30 plus years and having performed thousands of eyelid procedures, I think I can offer a few more insights into what she experienced. Please listen up.
I'm going to do a video on my most requested subject, my blepharoplasty, or my eyelid job. I'm going to explain the whole process and the recovery and healing time and let you know if it was worth it. And you definitely need to stay to the end because I'm going to expose a major complication and how you can avoid it. So quickly press that like button and let's get started. So let me go over the reasons why I wanted to have this done. Around 27 years of age, I noticed that my upper eyelid skin had began to get loose and it wouldn't rebound as quickly after putting on eyeshadow. It would stay loose and distended. I also noticed that it was harder to create a winged eyeliner effect, and a lot of times that eyeliner would bleed to my upper eyelid.
What Lorry Hill's concern was in regard to her upper eyelid is one of the most commonly cited reasons to have an upper lid blepharoplasty, and that is women in particular cannot apply makeup to their upper eyelid without the makeup smudging on the upper eyelid because the skin hangs down over the crease of their eyelid, and therefore it stimulates them to say, well, what else can be done? And a blepharoplasty is usually the solution for that.
As far as my lower eyelid, I noticed that when I smiled, I would see all these rolls just underneath here, all bunching up.
Now, sometimes those bunching rolls are muscle contracting underneath the eyelid itself. There is some lax skin here, but there's a limit on how much skin you can remove down here. Most of the time when you see those rolls, it's the muscle underneath that's actually contracting, like my hand, and creating an accordion-like effect on the lower lid. That requires an inhibition of the muscle contraction with something called Botox, which is a medication which we inject into the muscle, which helps to prevent contraction of that muscle and smooths out the muscle itself. The overlying skin, therefore, also becomes smoother after the injection of Botox. Yes, there is some times where there is some redundancy of skin underneath the eyelid, and you could either make an incision below the eyelashes and take out a little strip of skin, or you can laser the lower lid skin to tighten the skin, in addition to the Botox.
The skin under my eyes looked so loose and distended like a rubber band. In the summer of 2018, I went to see Dr. Ray Taban, who is in Beverly Hills. He is an oculoplast, but he specializes in eyes.
Dr. Taban, who I know is a colleague of mine, is an excellent oculoplastic surgeon in Beverly Hills, and he focuses primarily on eyelid problems, not eyeballs, eyelids. An oculoplastic surgeon is a great choice if you're considering having cosmetic eyelid surgery.
And he doesn't even do lasers. He would refer you out for that. So everyone told me that I was too young to get my eyes done, but Dr. Taban reassured me that he sees patients my age and even younger. And in fact, I was a moderate blepharoplasty candidate.
There are no particular age limits on when a blepharoplasty can or cannot be performed. I see patients in their mid-20s to their mid-80s to have blepharoplasties. Most of the time, the patients are 40 and 50 years of age. But there are exceptions in terms of when a blepharoplasty can or should be performed. Depends on the degree of laxity of their upper lids and laxity of their lower lids.
He needed to remove extra skin from my upper eyelid and also do a skin pinch on my lower eyelid. He said I didn't really have any fat to remove, although blepharoplasty sometimes does remove fat.
Many years ago, surgeons would always remove fat on the eyelid and create hollowing of the eyelid. The trend has been in the last 10 to 15 years to preserve as much fat as possible. Fullness of the eyelid and preservation of natural structures gives a more natural, ultimate, youthful appearance. And I agree with Dr. Taban that in Lorry Hill's case, she only needed a skin pinch on the lower lid and a conservative removal of skin on the upper eyelid.
Started giving me the numbing shots. I gotta say that was the worst part. Like, wow, that was very painful. It felt like the numbing shots you get at the dentist, except piercing your eyes. That's the best way to describe it. It was a piercing pain. But I got through it. And once he started cutting, I felt nothing. I felt pressure and I felt like a little bit of a push and a pull, but nothing else.
Lorry experienced a painful injection, which can to some degree be avoided by mixing the numbing agent, which is called lidocaine, with something called bicarbonate. And if you mix the two together, it changes what's called the acidity of the lidocaine and makes it more neutral and therefore more tolerable. So when you get the injection with that mixture, it's not painful.
Here's some footage. This is not me, but this is some footage of him doing a similar procedure in his office. Take a look. Dr. Taban had me open and shut my eyes and make certain expressions. The reason that Dr. Taban does this surgery under local and not general is because he wants you to be able to move your eyes in the way that you usually move your eyes, and so that he can know where to take skin and where to leave skin. This leads to the most natural results.
If the patient is having a procedure under local anesthesia, which is very common to have an upper lid blepharoplasty, in particular under local anesthesia, I pre-treat the patient with a pain-relieving medication before the surgery begins, so that after surgery, that medicine is already working and is really diminishing any discomfort that they may have. I also recommend, following the procedure, that they put the ice packs in Ziploc bags, okay, sealed. You don't want any of that ice dripping on your eyelid. You actually want it in Ziploc bags, because some of the ice can be contaminated with bacteria, and now you're applying it to open wounds and potentially causing an infection.
Time-wise, the whole procedure took about an hour and a half, and here's a video of me after. I'm pretty out of it. After the procedure, the staff had me sit down and relax, and then I was free to leave when I felt ready to, and they had told me to get an Uber.
I don't agree with allowing patients, even after having local anesthesia, to go home by themselves. I think any surgical procedure like this, particularly if it's upper and lower eyelid surgery, does require a person to accompany the patient home safely. I don't allow my patients to go in a cab or Uber home alone because I think it is potentially unsafe. That is my only criticism in terms of their procedures, especially if the patient has had any sedation of any kind, like Valium, before the surgery.
You really can't look at your phone or do anything that requires your vision because your eyesight is blurred for hours afterwards. As far as pain, that evening, I just felt sore. Am I satisfied? I am extremely satisfied, you guys. I wish I hadn't waited. I can see my eyeshadow better on my lid. I look more awake. Nobody ever tells me anymore that I look tired, so that's good.
I see Lori's pre and post-op photographs, and her eyelids look excellent. They have a very natural appearance. They don't look like they had surgery. That is the kind of result that I aspire to as well.
About 3 days after surgery, I noticed that I was actually looking more swollen and my face started to puff up. Look at this photo. I called the doctor's office and they looked at the photos and they agreed I was having some sort of allergic reaction. Well, come to find out, I was allergic to the adhesive in these pads that were used after surgery.
Patients can have an allergic reaction to some of the adhesives underneath the bandage. And if it's applied to the skin over several days, you can get what's called a contact dermatitis. It doesn't look from the photograph that she had a contact dermatitis though. It looks like she has swelling of the upper and lower lids. I'm not sure it was related to the adhesive itself. In addition, another common cause of allergies is actually the ointment that doctors prescribe. The antibiotic ointment can actually cause an allergy in some patients. So I've gone to using what's called bland eye ointment, which is not an antibiotic. Bland eye ointment is actually like Vaseline for the eye. So if it gets in the eye, it won't irritate the eye. I use that in preference to the antibiotic itself. Very often I will give a patient an oral antibiotic for 2 days after surgery in lieu of actually using an ointment, because ointments sometimes precipitate allergic reactions.
This increased my recovery time by days. If you guys aren't sure if you have a medical adhesive allergy, which is a very common allergy, please check on that before you have any type of plastic surgery. Surgery is really not a big deal.
It is true that cosmetic eyelid surgery has a relatively low risk profile in terms of having secondary problems and complications. However, no surgery should be taken lightly. Everything should be taken seriously when you approach the idea you're having an operation, because there are potential complications that can occur, including side effects that you cannot always anticipate.
Getting filler every 6 to 8 months, it really makes a lot more sense to just go ahead and have the problem taken care of with a blepharoplasty. They usually last about 10 to 15 years. That way you're not going into an office and spending, thousands of dollars every year on filler.
Filler is not always a substitute for surgery, and surgery is not always a substitute for filler. So one doesn't always negate the other.
As far as price, I paid about $7,000, maybe $7,500. In other states, I've heard of blepharoplasty being less expensive. I've heard of it being $4,000, $5,000, or $6,000. And of course, you don't want to bargain shop. You want to go with the best surgeon you can afford.
I agree with that. You should seek out the best physician to do the job. The best surgeons are doctors who perform this procedure frequently and have years' experience performing this procedure in a safe and predictable manner.
Sometimes blepharoplasty will be covered by insurance if the skin that is on your upper eyelid hangs down and obscures your sight.
The majority of patients who come in who want eyelid surgery after their 60s are patients who already have Medicare or insurance coverage. However, most of these insurance companies, including Medicare, no longer cover upper eyelid surgery unless it really, really covers your visual axis right through the center of your eye. They won't cover a little bit of overhanging skin. They consider that to be cosmetic surgery. And the surgeon who claims that the insurance company is going to cover it is not correct, because if Medicare reviews this procedure, they will reject it ultimately. You have to anticipate that it's going to cost you money out of pocket to have this procedure done, because it's considered cosmetic in nature. I think Lorry Hill did a good job in giving you an overview of a blepharoplasty and the experiences that she had, both the ups and the downs of the procedure. As an eyelid expert, if you have any questions, please leave them below. I'd be more than happy to respond to them. And please subscribe to my channel. I look forward to seeing you in my future videos.